Hello, and thank you for participating in this survey. I am Bobby Gallagher, a BCBA and doctoral candidate at the Chicago School of Professional Psychology. The chair on my research is Dr. Susan Flynn. This research is to help determine the social validity of strategies to reduce barriers to reproductive health care for females with autism spectrum disorder and limited language. Just to briefly review what is meant by autism spectrum disorder and limited language, or ASD and LL. ASD is a diagnosis that includes individuals with a large variety of abilities, but for the purposes of this study, we are looking to help those with limited language, or those that are nonverbal or not non-vocal, having limited language such as maybe using short 1 to 3 word sentences to express their simple wants and needs, like want juice or need bathroom, but they are not conversational. Some may use an augmentative device, but others may not. Deficits in vocal language or having limited language without an outlet, such as an augmentative communication system, can lead to frustration. Individuals with ASD and LL may also struggle with other challenges, such as change in routine. It's not every day that someone has to go to the doctor's office. Also, anxiety with medical visits is certainly not limited to those with ASD and LL, but it may be increased due to a lack of understanding of the processes or procedures, or being asked to comply with instructions they're unfamiliar with, or might even cause pain, such as getting your blood pressure taken. And then physical contact with unfamiliar people may also increase anxiety in individuals with ASD and LL. Additionally, some individuals may engage in challenging behaviors that interfere with completing a routine exam, such as self-stimulatory behaviors like rocking back and forth or flapping their hands. Some may refuse to comply with any of the instructions that are given, or they may engage in self-injurious behaviors such as hitting themselves or biting themselves. And also there are those that engage in aggressive behaviors such as hitting or biting others. These would certainly impede on the ability to complete a routine gynecological exam. In addition to the need for preventative healthcare procedures like all females, females with ASD and LL have needs that may be going unmet if they are not being seen by an OB/GYN practitioner. Researchers tell us that they have an increased risk for sexual abuse, and getting a gynecological exam to ensure their physical health is crucial. They may have an increase in behavior or mood challenges during menses. A visit to the OB/GYN office may help to determine the best interventions. Females with ASD and LL may have undiagnosed pain or discomfort related to menses, and a visit may help to rule out any probable causes. Additionally, undiagnosed PMDD, or premenstrual dysphoric disorder, has been documented in a few studies. Treatment for this may help to alleviate possible behavioral responses to the symptoms of this disorder. There is also an increased risk of breast cancer and other cancers due to lifestyle. Individuals with ASD and LL are often obese, sedentary, they do not take birth control, are not sexually active, and do not breastfeed. These are all predictors of increased risk of certain cancers. Here are some strategies that may be effective in helping individuals with ASD and LL to complete a routine gynecological exam. We'll review each one of these more individually in a moment, but they are visual supports via electronics, the use of what we call the PREMAC principle, social stories, modeling, video modeling, and using anatomically correct models. Some additional strategies are the use of reinforcement for completion of incremental steps and non-contingent extinction. Additionally, we will ask in the survey for you to suggest some of your own ideas if these do not fit what you think is effective for the individual that you are caring for. Visual supports, or the use of pictures to depict the sequence of steps that the patient will be asked to complete. Upon completion of each step, the picture is removed until all of the steps have been completed. This method provides a visual of the expectation and how many steps are required until the completion or the end of the visit. First, the patient is shown the picture of the scale and then asked to step up onto it. Following the completion of being weighed in, the scale picture is removed. Next, the patient is shown the picture representing blood pressure, and again, once this is complete, the picture is removed. This is the same for the pulse, for putting on the gown, and for sitting on the exam table. In an actual visit, there would be more pictures to represent each of the steps that would be needed to complete the exam. Visual supports via electronics is similar to visual supports in the previous slide, but provided on a phone, a tablet, or another device. The pictures are swiped through as they are completed. So using the phone, we can individualize these for the patients, taking pictures right in the doctor's office. And with this, the picture would be removed or swiped away as the tasks are completed. Doing blood pressure, the pulse, the gown, and getting on the exam table. So the pre-MAC principle, or providing the patient with a first-then scenario. So first you complete the exam, and then you will receive something, a preferred item, or access to an activity that was chosen prior to the appointment. So the pre-MAC principle is often used when we require that a non-preferred task be completed in order to engage in a preferred task or to receive a preferred item. Sort of like that rule of eating your dinner before you can get your dessert. The pictures can be individualized to the patient to ensure they comprehend, and in these pictures it's showing that first we're going to go to the doctor's office, and then you're going to get your French fries. Social stories are short stories that would describe the process of the exam and the requirements of the patient in a very short story form, often presented with some visual or picture to accompany the step being described. The story is read to the patient prior to the examination. It can be read multiple times at home before we even leave and right before someone comes into the exam room. Here's a short example of a visit to a general practitioner's office. This social story is available at positivelyautism.com for download, and this shows the steps that will occur for the patient. However, for the OBGYN visit, a specific social story would have to be developed. Modeling is a commonly used prompting procedure for many individuals with ASD and LL. This would require having someone model each of the required steps for the patient. Sometimes modeling can be provided in person with an individual conducting each of the steps from the beginning to the end of the exam. This, of course, has its limitations on how many steps of the exam could be modeled by another person in an OBGYN office. But modeling may be conducted on an anatomically correct model for both breast exams and internals if the patient is able to transfer that the information being shown to them will then occur on their own bodies. Modeling may also be provided via video modeling of an actor completing the steps, and this would be presented to the patient prior to the appointment, either at home or even in the doctor's office prior to being examined. Such videos may be available through the OBGYN office prior to the visit. They may contain graphic demonstrations, and for that reason they are not presented in this presentation. For some individuals with ASD and LL, the use of reinforcement for completion of incremental steps may be necessary. With the assistance of the caregiver, a reinforcer may be identified. Some individuals may require tangible reinforcers given to them after the completion of each step. So often, behavior-specific praise is offered as a reinforcer, such as, "I like the way you sat on that exam table." However, some individuals may require access to a preferred app on the iPad or an edible. An example of that would be if the patient completes being weighed, they're given 2 minutes on the iPad or a piece of candy. Next, they allow the nurse to take their blood pressure. Again, they're given 2 minutes on the iPad or a piece of candy. They allow the nurse to take their pulse. Again, given the time on the iPad or the candy, they put on the gown, and as you see each step, and they are given something following the completion of that step. Because this is so individualized, the caregiver may be the best person to inform the practitioner of the preferred item and the time that it may take before moving on to the next step. And for some individuals, giving access to something like the iPad may impede the continuation of the exam. So again, this is individualized and should be discussed between practitioner and caregiver. There is research to show that the use of non-contingent extinction is an effective method for helping patients through similar exam procedures. What we mean by non-contingent extinction is that any sign of discomfort or act of refusal, we end the exam. For some, a complete ending, and they leave the office to return another day in hopes to complete more steps. For others, ending for a moment or taking a break and returning to complete more of the steps within the same day. This could result in a completed exam exam and it may not. It may take more time, and practitioners and caregivers would have to be patient. But this is another way to help individuals with ASD and LL to get used to the examination process. I thank you for listening to this presentation. On behalf of myself and Dr. Susan Flynn, we thank you for your help with this research. So please return to the survey to complete the remaining questions.